So welcome to the virtual Gender 360 Summit event on the Crossroads of Exclusion. We're going to look today at the crossroads of gender-based violence with people with disabilities. We have a fantastic panel for you today. My name is Elise Young. I am a senior technical advisor with the Gender Equality and Social Inclusion team, the GESI team at FHI 360. And I am a white woman with almost blonde hair. I have a blue shirt on and a blue necklace, and in the background, you can see a white ceiling in my closet. I use the pronouns that I am using today are she, her, and hers. And we were going to do a poll, a short poll, for those who are participating today. We're really excited that you could join us today. For those who are able, and it's okay if you can't, but if you're able, we ask you to go to menti.com. That's MENTI.com. And the address is here on the screen if you're able to see that. And then enter this code that is on the screen and you can participate in the poll. The code is 1374772. Again, that's 1374772. And feel free to answer any of the questions that you would like to participate in. We'd love to get a sense of where you are joining us from today. If it's from North America, Middle East or MENA region, South or Southeast Asia. So please just take a moment and answer that first question. Again, if you go to menti.com, enter the code 1374772. Great. We'll just take a moment for people to fill that in. You fill it in on your phone. Click which region, you scroll to the bottom and then click submit. Okay, it looks like we have a good number of people from the United States, but we do have some from Sub-Saharan Africa, from South and Southeast Asia, from the Middle East and North Africa, and from Europe. Thank you. We're going to go to the next question. So now, please let us know which of these groups you are affiliated with. Do you work with an INGO, with a disabled person organization? Are you an academic? Are you a donor? Do you work with a multilateral institution, or are you independent? Maybe you're a consultant, or you're in between jobs, or you do other type of independent work. Okay, so we're seeing that we have several people from international NGOs right now. And then let's go to our next question. And our last question. We would love to get your input on what can we do better as those of us who are INGOs, or those of us who are donors, or whatever affiliation we're with, to better address gender-based violence against people with disabilities. Feel free to enter your ideas into the phone, and we'll see on the screen here what ideas are emerging. So it looks like greater awareness is a big theme. Education, needing to look at intersectionality, advocacy, inclusive policies. These are great inputs. Thank you so much. We're going to capture these as well. And in our follow-up report, we are going to share that out along with some of the key notes and takeaways and resources. We really wanted to make sure this is as accessible an event as possible, especially in light of the fact that it is focused on disability inclusion, among other things. So in that attempt, if you would like to use closed captioning, it is available by clicking it on the bottom of your screen, the icon. For closed captioning, you can turn that on or off. There is American Sign Language interpretation available. You will see ASL interpreters. It will help you. Please do hover your cursor over their image, right click, and then pin them, click the pin option so that they are always present for you as we make transitions. And then finally, if either Spanish or French language interpretation would be helpful for you today, you can click on the box at the bottom of your screen and sign into Voice Boxer. You can do that actually either through the web or the mobile app and by clicking at the bottom of the screen. Now, we really want to thank our co-host partners today. That includes IDDC, International Disability and Development Consortium, Mobility International USA, MIUSA, and Chemonics International, all of whom have helped us think about the format for this event, identify speakers. They've really been incredibly helpful. Thank you. And this is the team that's been working on this behind the scenes, the Gender Equality and Social Inclusion team at FHI 360, our GESI team. Thank you to our director, to our colleagues, Habtamu Buli and Kim Dixon. And a little bit about this event. We, as some of you may know, have been for about 6 years now supporting the Gender 360 Summit, which is an annual, sometimes biannual event to dig deeper into gender equality and social inclusion issues within the field of international development and humanitarian assistance. Back in June, with COVID, quarantining and such, we did switch to virtual and decided we really wanted to support a series of virtual events around the Gender 360 Summit. So this is our event 2, and hopefully will be even more accessible than the first one. Today is an important time period. It is the crossroads of 2 important international events. From November 25th to December 10th, it is the 16 days of global activism to fight against gender-based violence. And this is something that a lot of us have been working on. The other big event that we just recently had on December 3rd is International Day of People with Disabilities. So what better way to look at the overlap of these 2 globally recognized movements than to look at both gender equality and GBV impacts and disability inclusion. We are super excited, and I'm very honored to introduce to you our moderator today, who is a good friend and just someone I really admire within our industry, Meg Shanks. She is our speaker today.
I wanted to thank FHI 360 for hosting this amazing and powerful event. It's so important for us, and I'll repeat what Elise said, it is a critical time with the 16 days of activism, and also to recognize the UN's International Day of Persons with Disabilities, which occurred on December 3rd. It is a very critical platform for marginalized voices within our community, and we need to amplify those. We, as an international development field, have been ignoring these marginalized voices for so long, and it's time for us to take advantage of this platform to have a rich conversation. I look forward to the opportunities to explore gender, what that means, the binary way of approaching life thus far, of just men and women, but what exactly encompasses the spectrum of gender by addressing issues that target the non-binary and transgender community, and how we need to adjust the way that we've approached the work thus far to be able to be accountable to those communities. It's also important to have an intersectional approach when it comes to looking at disability. Forms of disability can be social, medical, and it's important for us to have a biodiverse view of our work. Biodiversity is this understanding of humanity that is a holistic view of what every person has to offer our field and the world. They have their own unique perspective and experience and backgrounds that is only a positive benefit when it contributes to the work that we have as a whole. We need to look at disability and how it changes based on the context that it appears. So we are going to explore these concepts through our wonderful panelists in our discussion today and how it applies to the context of gender-based violence. I would like to introduce our first panelist, and we have such amazing panelists for you today that will be able to contribute to this conversation and help us expand our understanding of decolonizing aid and international development. Decolonizing aid, that movement and their perspectives are ones that we're going to be leveraging today to have this very important conversation, to see people as their experience, their work, their environment in a holistic view. So these panelists will be talking more about their experience today. And before we get into a deep dive of today's discussion, I would like to take a moment to introduce myself and give a visual description. I'm a Black woman with natural short hair. I have a dark blue blouse on and a white background. I also have some dangly earrings on. I would like each panelist to also say what pronouns they'll be using today. I will be using she and her, hers to identify myself. Please also remember to at least once introduce our panelists. Our first panelist is Haptamu Buli. Haptamu Buli is an international development, disability inclusion, and special needs education professional with over 10 years of experience. He received his bachelor's and master's in special needs education from Addis Ababa University. He recently received his second master's degree from Gallaudet University's International Development Master's Program. Buli developed a passion for international development while he was attending Addis Ababa University. He co-founded the Association of Students with Physical Disabilities and the Deaf Students Association. He has led as the president and public relations coordinator. Buli is a former director of the Ethiopian National Association of the Deaf and currently is co-founder and president of the Ethiopian Deaf Community in the United States and a disability inclusion technical officer at FHI 360. Welcome to our panel today, Buli, and I turn the floor over to you.
Thank you. Hello, my presentation today will focus on our Gender Equality and Social Inclusion Framework 2.0 at FHI 360. FHI 360 has been committed to gender-based violence prevention and disability inclusion. As you can see, we've continued to address gender-based violence by incorporating more systems to measure, prevent, and decrease gender-based violence. Our framework is separated into two categories: organizational commitments and project commitments. Organizational commitments include staff diversity, staff responsibility, safeguarding, safety, and accountability. Project commitments include participation, which focuses on empowerment of underrepresented groups such as people with disabilities, ethnic groups, and other vulnerable populations. Most importantly, our gender-based violence prevention creates systems to measure, prevent, and decrease gender-based violence. Thirdly, through our partner commitment and diversity, we seek out partners who are committed to gender equality and social inclusion. Finally, our project commitment to standards strive to measure, and increase gender equality and social inclusion analyses, strategies, specialists, and indicators. Next, we will focus on disability inclusion at FHI 360, focusing on our talent pipeline and staff support systems. We begin by creating a 6-month disability inclusion task force. Through a strengths and weakness analyses, we were able to make key recommendations in order to improve our disability inclusion at FHI 360. One recommendation led to a creation of the full-time staff position, Disability Inclusion Technical Officer. After establishing a disability inclusion internship position, the full-time staff position was created. Our current officer openly identifies as a person with a disability. In terms of recruitment, collaborating with human resources to recruit and incentivize reporting people with disabilities. Lastly, we piloted 2 disability inclusion trainings for our staff, and we are in the works of creating more trainings for the future. In the next slide, I demonstrate how gender-based violence prevention is incorporated into our projects. FHI 360 aims to strengthen capacity of women, men, children, people with disabilities, and people of all gender identities to mitigate GBV risk, including physical, sexual, and psychological violence. Our approach addresses unequal gender and social norms at the individual, family, and community levels, using a 3-pronged strategy that incorporates prevention, response, and empowerment. We've made great strides with having 15 active projects that focus on gender-based violence using an intersectional lens. Moving to the next slide, I provide 2 examples of current projects focusing on gender-based violence. The first project is titled FHI 360 Nigeria Project, which focuses on prevention, risk mitigation, and multi-sectoral response to SGBV and Spotlight Initiative. We've also worked with the government and DPOs in Nigeria to ensure access for women with disabilities. Another example that I would like to share is the Community Lukatim-O Mary Project, located in Papua New Guinea. This project focuses on strengthening survivor services, family support centers, and governance and community prevention systems. What we have noticed based on the feedback from our projects that are working with key populations, there is an increase in gender-based violence during COVID-19. In order to address this increase, FHI 360 has established 8 actions to reduce gender-based violence during COVID-19. The first action includes gathering information to understand how violence impacts program participants. Number 2, develop strategies and plans to address the violence. Number 3, Equip your program team to respond appropriately to those seeking assistance. Number 4, create new ways to engage program participants. Number 5, update referral procedures, available services as well. Number 6, include violence prevention and response activities in annual work plans. Number 7, explore innovative ways to help people stay connected and decrease isolation. And lastly, the 8th action includes desegregate data related to COVID-19 outbreaks by sex, age, and disability. So ensuring that data is also documented. Thank you so much for your time today. Please do ask any questions that you have. Thank you.
Thank you so much for that presentation, Buli. That was wonderful. And I loved the long list of things that FHI is doing. I'll now pass it off to our next presenter, Ekaete Umo. Ekaete Judith Umo has over 20 years of experience as an international disability rights advocate and inclusive development expert. She is the founder and CEO at FACICP Disability Plus, an organization that seeks to promote the inclusion of women and girls with disabilities in all gender and developmental efforts. She is also a member of the advisory committee. And it's so great to see the rising of visibility for women, especially in the development community. She herself is a laboratory scientist, a microbiologist, and virologist, to be specific. And she holds a postgraduate diploma in education and a master's degree in social work. She has a plethora of experience in advocacy work, and we applaud all of Ekaete's efforts. And thank you so much for joining our panel today. Ekaete, you have the floor.
Thank you so much for that very kind introduction. And thank you once again to FHI 360 for putting this together. So my intervention today will just to share the works that we have been doing and maybe to contribute to the ongoing conversation around gender-based violence and how we can collectively, respond to gender-based violence, imputing the disability component, as it were. So I work for an organization called FACIP. It's difficult to pronounce most of the time, FACICP, FACIP. And during the pandemic, we thought we could also do something to ensuring that women and girls with disabilities, also were able to access services. So at that time, we commissioned a little study. It didn't actually start like a study. We started an informal WhatsApp group, trying to check on one another to see if we're doing well and what was the issues, and if there were any issues we could share. And so that led us to establishing the FACIP COVID-19 online situation room for women and girls with disabilities. And that online situation room was set up during the lockdown. And this was to help bridge the information gaps and also to help see, please, I tend to talk a little bit fast. Just try to slow me down in case I'm going too fast because of the sign language interpreters. Okay, so the online situation room served as a virtual safe space where women and girls with disability could interact, share ideas, seek counseling and other kinds of support. So at the point of putting together this online situation, we now commission a study. And the objective, of that study was to facilitate knowledge and experience sharing among women with disabilities, and to, strengthen our capacity on how to respond to any form of violence or situation that we might find ourselves, around COVID-19 situation. And so please, next slide, please. Okay. So from the study, we got about 105 responses, which took us through what women were doing. And it was a very exciting time, let me mention it. And this situation room was also launched around April or May, and for us to put. So women with disabilities were very happy to share their stories as at that time. And so from the findings, we got about 105 responses, and the respondent told us that women and girls with disability had a lot of challenge during the COVID-19, and they faced discrimination and exclusion. In fact, this time was like not double, but 3 times the amount of discrimination that they had faced before now. From the studies, it also showed that there was this socioeconomic impact on women and girls with disabilities, and they face high level of domestic, violence. And the feedback we got from that study indicated that 11% of women with disabilities were victims of direct domestic abuses, and such as sexual and psychological abuses. And this one happened during, the lockdown. And that 25% of women with disability actually experience direct physical abuse and violence. And as some of them told us, this was due to irritation. I think the caregivers were getting overwhelmed, and they were responding in a manner that was not too good for women and girls with disability. In fact, these abuses came from family settings. It wasn't an external abusers this time, because it was during the lockdown. So, and this further worsened the living condition of women and girls with disability, such as rape. Am I still connected? Okay. The feedback from women with disability from the online situation room indicates that the lockdown abuse, 11% of women with disability had experienced domestic and violent physical abuses. And nearly 20% of women with disability reported being subjected to domestic neglect during the lockdown. And 35% affirmed that the lockdown was a major cause of the abuses they suffered. So you can imagine the irritation, the economic issues, and all kinds of issues that would have happened during the lockdown. So this actually impacted greatly on women with disabilities. And 83% confirmed that they didn't know any woman with disability who participated in the COVID planning, implementation, and monitoring. 83% confirmed that they were not represented on COVID-19 committees. So despite all this intervention and responses to COVID-19, our general findings was that women and girls with disabilities were excluded. They were not at decision-making, table, and so they were just pushed to the margin. Please, next slide.
It seems we have lost Ikaite's connection, so we will turn things over back to Megan so that we can begin with the next panelist.
Thank you so much, Ekaete, for your remarks, despite the internet connectivity issues. Moving on to the next panelist, Karen Saba. She just finished her first Foreign Service Officer assignment as a General Development Officer with USAID in the Philippines. As a technical officer on disability rights, Karen has worked with several non-governmental organizations and international donor organizations from around the world. She has extensive experience living and working in the Middle East, including Libya and Iraq, where she designed and implemented refugee assistance programs for people with disabilities and conducted numerous empowerment and sensitivity trainings. She also led capacity building activities for civil society organizations, governments, and universities throughout the region. Her work has been highlighted by the Women's Refugee Commission report regarding disabilities among refugees and conflict-affected populations in June 2008. Karen holds a master's degree in international development from American University in Washington, D.C., and speaks fluent Arabic, French, and English. She's also been published in several articles on education and disability rights, and has completed research on people with disabilities in the areas of economic development. I'll pass over the microphone to you, Karen.
Thank you for that welcoming remark. By the way, I am a Middle Eastern woman with brown hair, purple glasses, and I am sitting in my study with a white and yellow background wall. For those of you who cannot see me, today I will talk about gender, conflict, and disability. And my presentation is based on the fact that I'm not just a disability advocate. It is based on my career experience, professional experience, along with my master's degree. So I am talking as an expertise rather than an advocate, because in a lot of time people think of disability rights as activists rather than experts, and we need to change that dynamic as well. And if you cannot understand me, please let me know, but I have cerebral palsy and a speech impediment. Okay, so I'm gonna say throughout history and globally, public entitlement have developed as a consequence of wars, providing incentives to war heroes who are disabled can help politicians gain more political support. That's true in every country, whether you are in the US, Libya, Egypt, or Iraq, or even the Philippines. Unfortunately, resources used for wars deplete the means to provide adequate maternal health and other social services programs. Therefore, increasing the rate of disability related to birth defect, especially if the use of chemical weapons such as the case in Iraq, northern Iraq. This, of course, impacts the status of women in this society. Because a woman's status is measured by her ability to bear children in many developing countries. If a woman bears a child with disability, her status in the community diminishes, and most of the time she endures the extra burden of taking care of the special needs child. Poor women with disability, on the other hand, practically have no status in the community because they are seen as asexual and unable to bear children and take care of the family. On the other hand, women with disability who are a little wealthy tend to have more autonomy than non-disabled women. The family might invest in her education and career as a way to compensate for not bearing children and not taking care of not having the ability to take care of a family. Next. Now the fact is, the real cause of war is that it creates a stratification among the disabled population, not only in terms of gender equality, but in terms of impairment. As I always say, we may not be the Sunni, Shia, and Kurds, but we are the physically disabled, the blind, and the deaf. We have our own internal issues in collaborating with each other. But to be fair, one has to keep in mind that those that include a disability face more psychological challenges than those who are born with a disability, especially wounded children, because their identities are somewhat entrenched with a physical strength. So, in essence, the donor has not yet focused on the social and cultural model, meaning most of development money, whether you are a multilateral donor or a bilateral donor, are given to health-related programs, not disability rights programs, especially during COVID. Okay. The needs, however, the needs of people with disability have not been mainstreamed across a broader development program. As a result, people with disabilities remain isolated. This directly impacts women, for it is the women who bear the burden of taking care of people with disability in times of war. Thus, at the end of the day, when we improve the predicament of people with disability, we will enhance automatically the status of women around the world. Thank you.
Thank you so much, Karen, for all those words of wisdom. And thank you for reminding us that we need to consider conflict areas and that context in terms of disability as well. And now our next presenter is Com Demezo. Com is a legal aid lawyer and gender and social inclusion expert with more than 5 years of working in civil society organizations and international organizations. He's currently serving as the Vulnerable Populations Inclusion Specialist for the USAID-funded Rwanda Duetse Imbere Ubutabera, or DIU, activity. That activity was implemented by Chemonics International. Com, please bring up your screen and take it away.
Hello, everyone. My name is Come Demezo, and I am happy today to join you and discuss issues around GBV and disability inclusion. So my name is Come Demezo. I'm the Vulnerable Populations Inclusion Specialist for the USAID Duterte Ubutabera activity, which aims at promoting access to justice. Trying to describe myself, I'm black, the true definition of black. I have blue shirt on and glasses. So my small presentation today will cover the following points. The first one will be the contribution of Rwanda to Tezibere Ubutabera. The Tezibere Ubutabera means let's promote access to justice. So we are looking at the contribution of the project of the activity in promoting access to justice by preventing gender-based violence and promoting inclusion of persons with disability in the activity. The next point, I will show the trend of GBV cases, the increase of GBV cases from 2017 to 2020. I will also discuss disability inclusion challenges. I will also discuss Rwanda DIU's activities in the promotion of GBV prevention and inclusive access to justice for persons with disability. And I will conclude my presentation by talking about some few recommendations that we have. So to start my presentation, Rwanda as country has made a great steps by ratifying the International Convention on Rights of Persons with Disabilities. Rwanda also made tremendous steps to ratification of different international conventions that protect women's rights. The country also has put in place the National Council of Persons with Disabilities to ensure that persons with disabilities do participate and benefit from the country's development. But according to the census, national census that was carried out in 2012, it was found that 40.5% of women are persons with disabilities, and 49% are men with disabilities, which equals to 4% of persons with disability in the whole country. So we were, in 2012, the country had 12 million of population, and the 4.4% were persons with disabilities. So it's quite understandable, based on the history of the country, the genocide against Tutsis, so we had many people with disabilities. So as I have been saying, in terms of preventing gender-based violence, Rwanda enacted a law in 2008 that prevent and punish the crime of gender-based violence. And also in the current legal framework where you have the penal code, which was revised in 2018, provides some heavy punishment for people committing crime of gender-based violence. So next slide, please. So at this moment, allow me to discuss the increase of the trend of GBV cases in Rwanda since 2017 up to 2019. So we experienced an increase of GBV cases starting, the statistics that I'm using now was from the UNDP that carried out the impact of COVID on socioeconomic aspect. The report was released in June. And one of the figures that we had is that from 2017, we had more than 400 cases of GBV that were received by Rwanda Investigation Bureau. And around 400 cases were submitted to the prosecution. In 2018, more than 6,000 cases were received by the Rwanda Investigation Bureau, and few of them were submitted to the prosecution, which is around 6,000 cases. And in 2019, we had an increase of more than 10,000 cases submitted to the Rwanda Investigation Bureau, and only around 8,000 cases were submitted to the prosecution. So in the fiscal year 2019-2020, we had an increase of 19.62 cases, and this was result of COVID-19. As we can, as the Rwanda Investigation Bureau put out figures, it was found that from May this year up to June, that's where we had a big increase of GBV cases. And at that time, the Rwanda was experiencing the lockdown. So apart from these figures, our local partner Haguruka, which is a women's rights organization, also recorded a number of increase of cases comparing to previous years. According to their reports, last year they had only 69 cases, but so far, up to September, they had recorded 425 cases. So you can imagine the trend of increase comparing to the last year where COVID was not there. But when you see at this moment, you see that we had an increase of GBV cases due to COVID. And one thing I would highlight is that our local partner Haguruka, to have that number of cases was due to the toll-free line, which was available due to the support of the project. So we can proceed to the next slide, please. So discussing some disability and GBV-related challenges, I can say that though we have made progress in terms of policy and laws, but we still have challenges in terms of implementation. First one, having disability in different programs is still a challenge. If there is a program on agriculture, a program on employment, a program in another sector, it is still difficult to find the integration of disability. So having this component across of everything we do every day would be of a paramount importance. But if we are not involving bringing persons with disability in our programs, so we are not doing the true inclusion. Another challenge that some of DPOs tend to forget GBV and gender inclusion in their programs. Most of the time, their focus is on health, education, and other sectors. But when it comes to understanding how the gender and GBV do intersect, they are still doing nothing. So there is a need of building, as people work in international development, there is a need of making sure that DPOs do provide how they are addressing the issue of GBV in their programs. Another challenge is the absence of statistics. I'm talking this in the context of the country. It's very hard to find statistics in different programs that are being implemented, whether by the government or by the non-state actors. To find figures of persons with disabilities is still a challenge. And then we cannot have a better planning if we don't have figures to base on. So it's very important to have figures to ensure that what we are doing, we really target these people and this number of people. And when we are developing tools to collect the people who benefited from our programs, we only mention sex disaggregation, but we forget also to mention that we can also have disability disaggregation to ensure that we have disaggregated number in both sex and disability. I can say that there are still false beliefs on the part of different actors who still have negative attitude towards persons with disability, believing that persons with disabilities, they can't do anything. So we still have such fight to ensure that everyone is on board and understand the importance of including persons with disability in all programs. Quickly, we also have limited access to information. We also have physical barriers. We still have physical barriers in different premises, which may limit persons with physical disability to access. Well, there are also lack of resources, which impeds persons with disability to navigate legal processes. We can go to the next slide. So at this moment, allow me to shed light on what our program, Rwanda DIU, has supported the government of Rwanda to ensure that persons with disabilities do participate and benefit from the activity we are doing. So Rwanda's DIU supported different initiatives. The first one was to build the capacity of DPOs themselves to understand their legal rights and also gender equality concepts. We also train different actors, including justice sectors and legal aid providers, CSOs, to be able to mainstream disability in their programs. We also supported our local partner, Haguruka, to develop a toolkit on disability inclusion. And across our trainings, we had trainings where we trained the community justice actors, whom we call Abunzi, to ensure and they understand these challenges we are talking about. So I can see that time is rushing, but I can't conclude without saying that DRU, in terms of fighting gender-based violence, Rwanda DRU supported our local partner Haguruka with a toll-free I have been talking about. During the lockdown, the project supported our local partners to air some radio spot raising awareness on the issue of GBV. And we also, before COVID, the project has been addressing the issue of GBV through mobile legal clinics and other community events, community gathering where our co-partners had to go and raise awareness on the prevention of GBV. So to conclude, as I conclude, I would say that we need to ensure that in our programs, we provide or we integrate persons with disabilities, ensure that they participate and also benefit from what we do. We also need to ensure that gender and GBV need to be in all programs we are doing. Ensure that these needs, the needs of men and women are addressed, and ensure that there is no discrimination based on sex and other types of discrimination that might prevent vulnerable groups to participate in our programs. So we need also to step up advocacy and awareness on GBV and disability, and also increase awareness on the intersectionality of gender and of GBV and disability. So thank you so much. That was my presentation today.
Thank you so much, Kulma, for that amazing presentation. And it really helps us understand from a legal perspective the importance of disability, gender, and GBV. We'll be moving quickly on to our next presenter, Cristina Francisco, who is a consultant and researcher on gender-based violence, human rights, and inclusion of people with disabilities. She is the founder and president of the Circle of Women with Disabilities, also known as CEMUDIS, an entity that promotes the leadership and participation of this sector. Cristina also founded and coordinates the Disability Alliance for Our Rights, IDDC, an entity that works together with 5 other organizations to promote political participation, employment insertion, and inclusive and social education of people with disabilities. Cristina will be presenting in spoken Spanish, and then you will hear an English translation following parts of the presentation. Cristina, I pass the microphone over to you.
Hola, muy buenos días. Un placer estar en este importante evento. Mi nombre es Cristina Francisco. Soy de la República Dominicana. Mi idioma es el español, pero voy a tener la asistencia de Víctor. He visto un vestido azul y soy de color negro. Detrás de mí están, estoy en mi habitación y están las puertas y esa es mi definición. Soy, me dicen comúnmente, señora o Cristina. Pues voy a presentarles lo que es el contexto de las mujeres con discapacidad en la República Dominicana dentro de lo que ha sido el contexto del COVID. Voy a iniciar dando una breve panorámica de estadística de la República Dominicana para que conozcan un poco de nuestra población. En el último censo que hizo la Oficina Nacional de Estadísticas, se manifiesta que en la República Dominicana existe un 12.3% de personas con discapacidad. Eso fue en el año 2010. Aunque a la actual realidad, la Organización Mundial de la Salud estima que esta población es mucho mayor debido al incremento de la discapacidad por accidentes de vehículos. Somos uno de los países con mayores accidentes de vehículos que dejan discapacidades o muerte. De ese porcentaje, 12.3%, el 56% es mujer con discapacidad, mujer o niña con discapacidad. Y de ese porcentaje, de todo el porcentaje, el 12.3%, el 37% vive en condiciones de máxima pobreza en la República Dominicana. La República Dominicana queda en el Caribe y muchas veces se desconoce condiciones de nuestra población. Muchas veces lo conocen simplemente por las playas bonitas que tenemos, Punta Cana y otras playas, pero no se conoce la realidad de nuestra población. Dentro de lo que ha sido el impacto del COVID, ha habido un gran impacto en esta población debido a la vulnerabilidad de que es sujeta esta población por condiciones de género, cultural, de exclusión y de pobreza. El impacto del COVID llegó de manera repentina y vino a desnudar o a visibilizar lo que es la realidad de una población que no está tomada en cuenta para condiciones de pobreza o condiciones de exclusión o como en este caso para pandemias. Por lo tanto, la afectación de esta población por su interseccionalidad ha sido mucho mayor por la exclusión de género, violencia y violencia de actitud. Todas estas condiciones de vulnerabilidad han hecho que el COVID haya impactado grandemente, mucho más a mujeres con discapacidad que incluso a hombres también con discapacidad, porque se les suman situaciones de interseccionalidad y culturales. El COVID ha impactado en cuáles aspectos. En el económico, muchas de las mujeres con discapacidad son trabajadoras informales, hacen artesanías, salen a la venta a las calles de productos. Con las restricciones del COVID, estas actividades fueron suspendidas. Las que tenían un empleo fueron suspendidos o sus familiares o parejas, trayendo con ello mucha preocupación al no tener un sustento económico. Otro aspecto que afectó grandemente es que por el COVID la educación tuvo que ser transformada y desde la casa a través de la tecnología. Pero no todos los niños, niñas con discapacidad jóvenes con discapacidad tenían el soporte, una computadora, conocían o manejaban la tecnología para poder insertarse en este sistema educativo. Otra barrera fue la comunicacional. Muchas compañeras nuestras son sordas y la mayoría desconocía lo que a diario eran las instrucciones que se daban a través de la prensa, informando las medidas que había que tomar, las acciones que el gobierno estaba tomando con diferentes sectores que no fueron tomados en consideración debido a que la mujer con discapacidad, por restricciones, no tenía el soporte para salir a gestionar los apoyos que se estaban dando para la población en general. Desde nuestras entidades tuvimos que dar soporte, hacer contacto, llamar para que esta población sí fuera tomada en cuenta en cuanto a las medidas que el gobierno estaba tomando. De todas maneras, no dejaba esto de producir mucho temor, mucha frustración, mucha depresión al no tener respuesta de cómo poder asistir a un centro médico si era contagiada. No tenemos un sistema de transporte público accesible. ¿Cómo movilizarme si no tengo acompañamiento por las restricciones del COVID? ¿Cómo voy a ir a un centro médico, al supermercado o al hospital si estoy sola? Y todo esto generó mucha y ha seguido generando mucho estrés, depresión y preocupación, debido a que no tenemos en nuestro país un sistema de cuidado para las personas con discapacidad severa. Y todo esto ha sido terrible saber que las compañeras con una discapacidad severa han estado solas en este proceso. Algo que también nos impacta, y no solamente en el contexto del COVID, sino desde hace mucho tiempo, pero que esta vez ha venido a ser más visible, es las barreras en los hospitales. Los médicos, perder, por ejemplo, las citas médicas, las terapias, y todo también ha sido impactante para nosotros y ha afectado nuestra salud. Desde nuestra entidad hemos podido dar un poco de soporte con llamadas telefónicas, con psicología, compañías que de manera voluntaria han ofrecido programas para dar orientación, soporte, para manejar el estrés, para manejar todo lo que ha sido ese soporte. Sin embargo, la falta de accesibilidad ha sido una de las principales causas para la mujer con discapacidad enfrentar todo lo que ha sido la pandemia del COVID. Muchísimas gracias, un placer. Esto es todo hasta ahora.
Thank you so much, Christina, for that amazing presentation. Unfortunately, time has gotten the better of us, and it is slow. Our time together today is coming to a close. So if all the panelists could bring up their video, we'll start with our question and answer session. Yes, I'd like to present one question. I hope we have time for one question. We in international development are talking about this entrenchment of racism and colonialism because aid had traditionally been given by Western powers without consideration of cultural and linguistic values of those formerly colonized countries. And we really need to unpack this question. And my question is, how do those of us who identify as development workers begin to decolonize gender-based violence programs and funding to become more inclusive of people with disabilities and change unfair power dynamics? I open it up to the panelists to answer.
Well, this is Karen Saba.
Bully, would you like to answer?
Sure. Or did someone else have their hand raised? Karen?
Yes, Karen, would you like to comment?
I'll make it short. I'll make it very short and say we must not forget that all foreign aid programs should be consumer-based with ownership by the local power structure that cuts across gender, class, ethnicity, and disability. However, that is easier said than done because there is also a lack of transparency, not enough training, and not technical knowledge. But that's what needs to happen. Thank you.
Thank you so much for those remarks, Karen. And next, Bully, would you like to add?
Thank you. That's a great question. What comes to mind is decolonizing aid. That is a hot topic in ID world. And I think it's a process that many organizations should start doing. Specifically at FHI 360, we have a decolonizing aid task force, and it specifically focuses on global health. And that allows us to have a reflective practice in order to unpack the Western powers. I also believe that it's important to design GBV programs and disability inclusion with frontline people, but we still have a lot to go. We still have a long way to go thinking about systematic change and thinking about how can we identify other key populations that have been forgotten. Sometimes we are stuck with what the donors give us and we have limitations on who can we involve and what we can do. But I think it's definitely important that we co-design with disabled people's organizations and with those frontline workers and also key populations. And while there is a lot to do, we definitely need to start now, especially as NGOs, private sectors, multi-sectors. I'm really taking an opportunity to make this change and going back to the communities and having these rich and diverse conversations to figure out what they need. And so that might be helpful. That might be a good approach to start.
Great point, Bully. Thank you so much for those remarks. Any other of our wonderful panelists like to add to this conversation?
Pienso que
Christina,
es
go
sumamente
ahead.
importante que esos sectores tomen en cuenta, muy en cuenta, la interseccionalidad cuando hablamos de género, de discapacidad, de mujer, negra, pobre y en condiciones de pobreza del sur global.
Yes, great point. It's so important for us to keep that in mind. Kome, anything you'd like to add?
Yeah, thank you so much for that question. What I would like to say is that foreign countries or Western do provide support to developing countries or other countries who are in need, but ensuring that the recipient countries are understanding the issues of intersectionality, that's another topic. For me, in my understanding, people in developing countries or people or we still have many people who need to understand the issue of intersectionality. People who need to understand that we are diverse. We are coming from different backgrounds. We are coming from different tribes and different cultural backgrounds. So if at the first moment, people or the recipient countries will understand that diversity, things of having few people benefiting and many people losing, we cannot have that kind of things. But if we have that kind of ensuring that everyone benefit regardless his color, his ethnicity, his social groups, that would help to ensure that the foreign or Western fundings are being utilized in ensuring that everyone participate and benefits. That was what I can say. Thank you.
Yes, thank you, Kome. That was an amazing point. Very salient. Thank you. I think, Kayete, would you like to add to the conversation, or would you like me to move to close?
Okay. I just hope my internet will allow me. It's not a good day for me today. I'm sorry. The internet has been messing up. So I just wanted to add to that conversation. And I asked foreign aid for what? You know, I give my experience. International agencies or donor agencies will approach you and say, okay, they want to give you funding for XYZ. And already they have a goal, they have an objective they want to achieve, and they expect you to design your project in such a way that it will feed into the goals and the objective. So I'm just wondering if we can get to a point where there could be a kind of research or getting to understand the community that you're trying to offer this aid or help to, and exactly what needs to be done and how it needs to be done. For a very long time, it's like helping the donor to achieve the overall objective. It's just like trade agreements. You're coming to my country, what is it exactly you want to, help the people do? I think it's about time the conversation should be in such a way that everyone will sit and begin to design how the interventions will look like. That way, voices that have been excluded, we have the opportunity to contribute to the design stage of the whole thing. And even if it gets to at the international arena or where the donor agencies will sit and say this pot of money maybe is coming to Africa, African forward. So I think interest, there's kind of interest here, and we need to take all kinds of interest into consideration when we are looking at foreign aids or the intervention that needs to happen in certain countries. Otherwise, it will also be, we keep talking about, it being one kind of approach, and that inclusivity may never ever may take place as we go on.
Wonderful. Thank you so much, Ekayete, for your contribution to the conversation. I want to thank you so much to all of the panelists for their time, their vulnerability, and their willingness to be so open in this dialogue. And I will pass off the microphone to Elise to wrap up the event for today.
Thank you so much, Meg, and that was a fantastic moderation job. And thank you to all of our panelists. Wonderful contributions, a lot to think about. I have follow-up questions. I know that we didn't have time for questions for our audience, but if you do have questions, please feel free to put them into the chat, and we will seek with our panelists to answer them in the follow-up. We have some already in the follow-up email that we'll send. We want to really thank all of you for contributing. We'd like to thank the GESI team at FHI 360, including Julian Heaney, who did such a great job helping us coordinate this. Accessibility is not an easy thing, as you can see, but it's something worth striving for and learning and growing into, and we are learning and growing. So thank you, and our apologies. Thank you for being patient with us as we work through our own growing pains, but it has been incredibly enlightening, and thank you to everyone who has helped us also to think through accessibility for this event. We welcome your input as attendees. We know it wasn't perfect, but that's how we grow. So please give us feedback. We really welcome it, of how we can make this even more accessible in the future and iron out any kinks. And then thank you to Meg for being a brave, intelligent, progressive voice in this international development field. We hope that you'll continue to challenge us and support us as we move forward, and we've really appreciated the collaboration with Gallaudet. And then thank you so much to our co-hosts, partners today. Thank you to IDDC, the International Development Disability Consortium, and Angelique especially. Thank you to MIUSA, Mobility International USA, to Susan Siegel, Susan Dunn, Ashley Holden, and helping connect us to Christina, to Ekayate and beyond. And thank you to Chemonics International, Kaylin Sullivan, Brandon Ryan, and helping connect us to Christina. To Combe, we really appreciate this collaborative approach. We welcome you to join us for our next event. We're aiming for June. Look out for an email for that. And again, send us feedback, send us questions. We look forward to continuing the dialogue. Have a great day, everyone. Thank you so much.